Hi there, it's Sharon Whiteman here. I'd like to welcome you to a quick intro into Lyme-like illness in Australia. I'm the current president of the Lyme Disease Association. I'm a Lyme patient, mostly partially recovered. I'm a mum and I'm a business owner as well. Lyme disease is an infectious disease. It's caused by a bacteria called Borrelia, and it's considered to be the fastest growing vector-borne illness globally. It first, initially, when it was discovered in the US, was thought to be just a single strain, but as research progresses, they're now thinking that Lyme disease, they're publishing that Lyme disease is caused by multiple strains of Borrelia. With no contemporary Australian research, Lyme-like illness is the name that's favored at the moment. So globally, vector-borne disease is both preventable and treatable. That's the World Health Organization. It's considered the fastest growing vector-borne disease. That's US reporting. Up to 300 strains of Borrelia are reported globally, but not all have been tested for potential impact on human health. In 2014, the US added Lyme disease as an indicator of climate change with the increasing incidence. They indicate 300 new cases per year, while Germany estimates 60 to 100,000. China indicates that 5% of their population could be affected. Birds can be hosts, so ultimately anywhere birds fly, Borrelia can be found, which it's been found in seabirds in the Antarctic. Californian birds show that 57 out of 100 birds with ticks on them tested positive for Borrelia, and a recent Canadian study shows Borrelia burgdorferi in ticks on their migrating songbirds into that country. The US, you can see here that West Nile, HIV, and breast cancer all are significantly smaller incidents than Lyme disease. And, you can see that almost no recognition gets. It's a huge problem and it's largely ignored. Australia, Lyme disease has been diagnosed in every state, city and bush areas alike, and at any time of the year. Over 1,500 medically confirmed cases have been reported to the Lyme Disease Association, and Lyme treating doctors indicate that they've had more than 4,000 treated on their books. 70% in Australia do not remember a tick bite, 25% had never left the country. We expect our incidence here to be similar to the US statistics per capita. You can see here, these are Australian houses with someone who's reported to us that they've been medically diagnosed by a doctor with Lyme disease. So it's spread all around our country. There has been research published, and you can see here 6 examples of studies. Then in 1995, a prestigious study was done, and they failed to find evidence of, they looked for 3 different strains of Borrelia, didn't find it. And for some reason, this continues to be the research referred to, so it negated any previous evidence. Fast forward to 2015, and Professor Peter Irwin out of Murdoch, he's now studying ticks, and he's isolated to date 5 brand new pathogens, including a relapsing fever type cross reptilian Borrelia from ticks off echidna, and his research is continuing. But again, they haven't studied as to whether this can affect humans. Blood tests are failing patients. Just to give you, there have been 2 Lyme treating labs that are accredited. Westmead, you can see that their testing between Westmead and POMS were very different. One only would call it positive if they had 5 out of 10 positive bands, and the other was looking for 3. And there is a Lyme specialist lab, Australian Biologics, but they are currently seeking NADA accreditation so that they can have their tests accredited. In 2012, the Chief Medical Officer convened an advisory committee, and it wrapped up after a very short time in July of 2014. And Professor Bagley, who's the immediate past Chief Medical Officer, published some findings and some determinations. He asserted that there's a Lyme-like illness in Australia. Blood tests are relied upon but are unreliable, as I just explained. He committed to addressing blood testing inconsistencies. He outlined research priorities, but there was no budgetary support for those. And he committed to a tick bite awareness and prevention campaign in conjunction with the state and territories. As of this year, there's been no progress on that in a way that would affect patients, although at a bureaucratic level, I understand they're still undertaking those steps. In 2015, after some time of waiting, we connected with Lyme patients in the community and asked them to send educational postcards to their MPs and senators. Over 20,000 postcards were sent, and then our team followed up with those MPs and senators, telling them about our situation. This caused a House of Representatives roundtable to be convened in September 2015, and a Senate inquiry into Lyme-like illness, which commenced in November 2015. Now, the Senate inquiry was seized due to the double dissolution, and we're now continuing to engage with candidates and senator-elects to ensure that the inquiry is resumed. So if you have a relationship with your MP or senator, we highly like your support to plead our case that this group of Australians really needs recognition and support. We assert that a single 20-year-old research study should not be used as the basis for ruling out the possibility of Lyme disease or Lyme-like illness in Australia. In no other area would they rely on such dated research when research is progressing so quickly and research methodology is. No one's arguing that Australians are sick after tick bites. There's no scientific validity in denying positive blood tests because the decision makers are wanting to prove that ticks are competent to carry the bacteria. So in the short term, patient tests are denied. So we contest that this is an emerging disease situation, and that in an emerging disease situation, patients show up sick. They're the first evidence of a disease. And so our Australian patients should be treated with the best of the knowledge today, while research is urgently prioritized. At this point, I'd like to thank the Country Women's Association of New South Wales for their generous donation, and the LDAA is about to commence in the coming months an epidemiological retrospective view on patients that will start to show some of this evidence. So it presents early like a flu, very innocuous. You may not realize, especially if you haven't had a tick. There may or may not be a rash, and the bullseye rash, as indicated here, our survey showed only 35% of patients reported having them. As time progresses, bacteria can quickly spread, even in a matter of hours, into tissues and organs. It's typically an invisible illness. So the person you know or someone you might meet who has Lyme disease, you might not be able to tell by looking at them. And it's most often misdiagnosed. Because of its lack of recognition here in Australia, they're not looking for Lyme disease, so therefore they get grouped based on their symptoms, which can be very unique in each patient. So we'd like to assert that anyone that's been diagnosed with multiple sclerosis, rheumatoid arthritis, Alzheimer's, motor neuron, Lou Gehrig, Parkinson's, lupus, chronic fatigue, sarcoidosis, ADD, and autism, or anything that's an atypical diagnosis, you deserve to have the right to have Lyme disease considered as part of the differential diagnosis. And then on top of that, it's not just the Borrelia bacteria. There's multiple co-infections. It's usually considered to be a constellation. International best practice, Dr. Horowitz, he indicates he's never treated a patient that had a single infection. So this understandably makes it even more difficult for our Australian doctors. It causes a very varied and complex presentation of the patient. The immune system can be very overwhelmed very quickly. And the symptoms can be very different in patients. They can be severe, they can be mild, and they change, which, in Western medicine, that usually gets labeled as a psychiatric situation when symptoms come and go, but it's typical with Lyme disease. Early Lyme treatment should be a minimum of 6 to 12 weeks of antibiotic therapy, 2 different antibiotics, and should continue beyond symptoms. While late treatment, it's a marathon. It needs to be individualized. It requires a whole combination of therapies because every patient is unique. And you must include integrative therapies like nutrition and detoxification, support for the body. We'd like to say that peer support is critical. It's as important as having a knowledgeable doctor. And, 100% recovery may not happen. We've got some patients that have been sick for 30 years. But I can say that you can improve your quality of life, and I definitely have. Unfortunately and tragically, left untreated, Lyme disease can be fatal and has been in several cases in Australia. We know of up to 25 patients. Our Lyme patient experience, that patients report being significantly impacted in their life. 50% travel long distance. 130 in 2014 alone traveled to Germany for treatment. And that's at a cost of 50 up to 100 grand for that patient or family. 70% of patients take time off work or school, and 50% had to quit their jobs. 38%, significant number, report having suicidal thoughts. And sadly, they've got a significant decline in their quality of life. They've got gross deficits in their ability to function. They're very socially isolated and often not believed by their family, community, doctors, and they experience extreme financial devastation. And you can see here, this is reflected on, this is the U.S. Lyme Disease Organization that's published this. And you can see there on the left, chronic Lyme disease, that they have a 72% impact in their quality of life. And this chart is comparing them to to congestive heart failure, fibromyalgia, diabetes, MS, depression, asthma, and then the general population. So Lyme disease is a serious, debilitating disease. But the good news is that they do get better, they improve, they have better quality of life. So it's important, if you know someone has symptoms following a tick bite, seek informed assessment, be persistent. And if you have one of those diseases I've listed before, you really need to be persistent in seeking support, get peer support, and definitely thank you for watching and listening to this, for advocating and supporting your sick members of your community and family. It's really important to be clever and aware of ticks. So there's some certain points here that you can read, and really there's still a bit of controversy in regards to the most effective way. Historically, it's been not touching the tick, so being as close to the skin as possible, because squishing or stressing the tick at all can cause it to inject more saliva, thus more pathogens. There is some new recommendations in Australia using a freezing spray, and they are currently researching as to whether that actually is the best way, but there's no evidence to that as of yet. So thank you for listening. We're a small charity. We're powered by volunteers, and really we represent the immediate and future needs of Australians with Lyme-like illness. You can help us. You can volunteer or donate to us, spread the word, share our websites and flyers, participate in our Random Acts of Lymeness campaign. There's lots of ideas, little things that can really make a difference. So thank you for listening. We appreciate you, and spread the word.